Senate study committee with people with intellectual and developmental disabilities, but I'm going to change that right now. This is about helping those with special needs. They do not have disabilities. We do. Because if the world would see through the lens of someone's special needs, it'd be a better place. I have asked your very own senator from this area, Senator Chuck Hufstetler, to come up to offer a blessing and a welcome from Rome. We also have Representative Katie Dempsey here from the area, who does a phenomenal job in the House of Representatives. And I'm going to take a moment to brag on both of these two individuals. They have both been leaders in the Georgia General Assembly. The work that they have done, not just to represent the whole state, but for you right here at home, is unmatched by almost anybody who has ever walked in that Capitol building. So to Katie and Chuck, please take a moment. Let's give them a round of applause they justly deserve. And I'll turn it over to Senator Hufstetler for a blessing and an introduction.
Thank you, Senator. If we could all bow our heads and pray. Our dear Heavenly Father, we thank you for this day that you've given us, for all that you have given us. We know how good you have been to us in spite of our sins. And we pray that you would continue to lead and guide us and give us your wisdom in all that we do. We thank you for the interest in taking care of those that you commanded us to take care of, the least of these, and that we would do what we can to get the full potential out of everyone we can, and that you could lead us in everything we do, and for it to be all to your honor and glory. We ask all this in your name. Amen. We do thank everybody for being in Rome here. As Senator Albers said, I'm a senator here, and Katie and I go way back about 2000 or so. She was on the city commission. I was on the county commission. I took a 6 or 7 year break in there, but somehow got back in afterwards. But Rome and Floyd County has two rivers, the Etowah and Oostenaula, that meet and form the Coosa River, and we're the foothills of the Appalachian Mountains starting. So our theme here is where the rivers meet and the mountains begin. It's a beautiful area. We've got 4 colleges here: Georgia Highlands, Northwest Technical College, Shorter College, and Berry College. Berry College is the largest campus in the world at 32,000 acres. And as a side note, they're building a facility that will have 48 positions for intellectual disability people that should be ready in the next year or two out there that's going on right now. So there's a lot of good things going on in this community in that area. We are certainly happy to have everybody here. I'm in healthcare at Redmond Hospital here, where I do anesthesia, and certainly I'm aware of many of the issues and the pitfalls that are out there that we try to overcome with. And as a side note, Senator Harrell here had a child at Georgia Tech. I had one at Georgia. She's a Democrat, I'm a Republican. Our children are out there together in Oregon in graduate school working on their PhDs. My daughter in geophysics. And Senator Donzella James is my suite mate. We have 2 senators assigned to each suite, and we're in there and work together. So unlike what you see up in Washington, D.C., we work together on many issues. We work in the messy middle where things actually get done, not on either extreme out there. And I hope Georgia will continue to do that and lead this state. Again, welcome. Hope that we have some great things that come out of this meeting, and look forward to everything that happens here.
Thank you, Senator. Okay, we're going to get started, and I'm going to kick it off. Then our co-chair, who actually started this study committee, I want to thank Senator Sally Harrell, who has had a great passion with this issue as well. But I want to recognize a couple people. First, I want to thank those who worked here today to both offer the facility as well as set up this beautiful room at the Rome Civic Center. So thank you very much. We appreciate you. And there are several important people behind us. We'll have committee members introduce themselves in a moment. But the first person here, right behind me back toward the side, is Allie Farmer. She is gracious enough to support me, but she helped to coordinate and set all this up today, so we're grateful to Allie. We have Caitlin from our budget office. We have Jocelyn from the Senate Research Office. And we have both Keenan and Andrew from the Senate Press Office, which are also handling all the things you're seeing as we live stream this today, as well as put stuff up on the screen. So there's an army of people here to help, and I'll turn it over to our co-chair, Chair Sally Harrell.
Thank you, Senator Albers. This is another example of bipartisanship because we are co-chairs, and I am a Democrat, and Senator Albers is a Republican, and it has been a pleasure to work on this together so far. This is our third meeting out of 5. We will also be traveling to Tifton, Georgia, and then we'll have our final meeting back in Atlanta, I think in November, so that we can wrap up recommendations. I am thrilled to see such a huge crowd out there today. You guys passed the word around, didn't you? Really, it's such a pleasure to see you here today. We want to hear from you. What we're hearing so far is that these services are really in crisis, and that I think the solution is going to need to be multi-pronged and comprehensive. And that's why I decided to author this study committee, because I was starting to figure out that was the case, that we were sitting on a really big issue here that needed the attention that a study committee can give it, because a study committee is an official committee of the Senate and is therefore staffed and has resources, and the recommendations carry weight in terms of budget steps and legislation steps when we go back into legislative session. There is a sign-up sheet here at the podium. If you want to speak in the public hearing and have not signed it, you should do so. Before we get to the public hearing part, we do have 4 speakers who are part of our agenda, and so we will begin that now unless anyone has anything else to say. Oh, yes, we need to have the committee members introduce themselves. So I understand we need to pass the mic on the stand. So I will begin that process.
Thank you. Thank you. Hello, everyone. I'm Brian Dowd. I think I know a lot of folks here. I'm the Deputy Executive Director over Policy, Operations, and Compliance at the Department of Community Health. We're the single state Medicaid agency. That's a really fancy way of saying that I'm the policy guy. That's about as simple as it gets. I'm the person over how people, not just me, but over all the policies for what Medicaid pays for and how somebody becomes eligible. And it's really a pleasure to be here today.
Thanks, Brian. Good afternoon, everyone. My name is Ashley Caseman. I'm the Director of Waiver Services for the Department of Behavioral Health and Developmental Disabilities. I manage the policies for DBHTD, which is the operating agency for the Medicaid waivers. It's great to be here today. Thank you so much.
Hello, I'm Senator Donzella James. I represent District 35, and it's a pleasure to be here today because this is one issue that I'm very, very serious about. I have a grandson that's autistic, and I've been around many special needs kids, and we're the ones that need to call ourselves the disabled, because people misunderstand them. But I want to do everything that I can on this committee to make sure that we help our young people and older ones, because there are some who age out and they need help and love too. So thank you.
Hi, everyone. Can you hear me? There we go. Hi, everyone. I'm Darcy Robb. As of the start of this month, I am the new Executive Director of the Georgia Council on Developmental Disabilities. Oh, thank you. And I am so thrilled to be in this position. This means a lot to me and to my heart, as I think it does to everyone in this room. Our mission at GCDD is that we want to make social and policy changes so that folks with developmental disabilities and their family members can live, learn, work, play, and worship in their Georgia communities. And obviously being able to do that in community like we all want to do, the waivers and paying DSPs a wage they can live on are critical ways to do that. So I am so grateful for the work of this committee. Senator Harrell, Senator Albers, I'm so grateful for your leadership. Senator James, for your passion. I know we've got Senators Burke and Harbin as well, and my fellow committee members down there, Ashley and Brian. Yeah, I'm just really excited to be here, and I'm grateful for all of you in this room. I'm really eager to hear from you today.
Okay, so our first speakers are actually committee members. So do you want to give your presentation from there? Is that okay?
Thank you. And I will be very brief just to allow sufficient time for testimony today. Last session, we discussed the number of individuals who were admitted to a NOW or comp waiver. Just a reminder, in July, we had 31 individuals that were added to a NOW or comp waiver. This is thanks to the efforts of Senator Harrell, Senator Albers, and Governor, who added 513 waivers to last year's budget. For August, I am pleased to announce that we have 52 individuals who were admitted to a NOW or comp waiver. In addition to 31. Yep. Thank you for that clarification. Thank you so much.
First of all, forgive the glasses. I have a big box of reading glasses, and I don't care what they look like. When you get old like me, you'll understand that, and you'll be like, yeah, I get it. So I was asked to speak today on the American Rescue Plan Act. There's been a lot of talk about what the Department of Community Health is doing in relation to the American Rescue Plan Act and the additional funding that we are able to draw down and use for home and community-based services. And I promise I'm going to do my best not to be too nerdy with this. First of all, I do have a handout for the folks here, so let me go ahead and do that. I have a few extras as well. It's very basic, but it does include the DCH website, which is dch.georgia.gov/programs/HCBS, and you can track what we're doing with these additional funds on that website. We're putting all the information on our home and community-based waiver page. You can also just Google Department of Community Health or DCH Georgia HCBS, and that'll come up. That's what I do. I don't type in the website. So as part of the American Rescue Plan Act, the states were allowed to draw down additional federal funding. So Medicaid is 2/3 federal tax dollars, 1/3 state tax dollars in this state. It varies by state. And what the American Rescue Plan Act did said, hey, we're going to give you an extra 10% for home and community-based services in tax dollars. That's great for a state like Georgia because that frees up 10% of state funds to use on something else, right? And they said, we're going to look at a period of time to give you this extra 10% from April 1st, 2021 through March 31st, 2022 to draw down your pool of extra 10%. Now, we've done that initial draw. That will change. So the number I'm going to give you is not set in stone because claims still continue to come in and some claims continue to get pulled out of the system. But it will probably be slightly more money than the amount that we anticipate, which is $191.9 million. So that's what we have to spend as far as the American Rescue Plan Act. Now, we can't just do whatever we want with the money, right? Because there's a federal government and the Centers for Medicare and Medicaid Services has lots of rules for us. So it has to be spent on home and community-based services. We can't spend it, for example, on dentists or hospitals or nursing homes because the money comes from claims we pay out for home and community-based services, so it needs to be reinvested into those services. Likewise, it has to be sustainable or one-time things. If we're doing one-time payments for folks, as for providers, for incentives, we can do that. But something like a rate adjustment has to be sustainable. These funds have to be spent by March 31st, 2025, or they go back to the federal treasury. So we do have to spend this extra 10%, that 191 million, by that time period. Another really important thing, everything I'm going to talk today about is kind of in draft, and it's not finalized because we can update the plan every quarter, which is a great thing that the federal government is allowing us to do. If we go down a line and we say, hey, we didn't need that money for this, or we've discovered we need more money for this rather than that, we just have to update our quarterly plan and get approval by CMS. That's all we have to do. So I'm going to go through briefly what we have right now planned to spend the $191 million on. To date, we've only spent about $14 million of the 191, so we do have a lot of it in reserve. We look to build a new case management solution, not for now and comp, but for our other waivers, our elderly and disabled waiver and ICWP waiver. The now and comp waivers have a set case management system, but the other waivers don't. We also look to improve our critical incident management system. Those of you that are providers know that we do have an online place where you can submit a critical incident system, but it's not very robust, and we'd like for it to be more user-friendly, so we're allocating a little bit of money for that. We have introduced a new service that we will pay for all children under the age of 21 that is currently with CMS for approval, and it's called behavioral support aids. So one of the things we learned from when we implemented autism therapy back in 2018 was that it was a great benefit for families who had children with autism. But it is therapy. It is like occupational therapy, speech therapy, physical therapy. And what we learned is many families with children under the age of 21 need help in their homes, right? They need somebody who is there to help them with things like skill building, that elopement issues, self-harm issues. And so we have introduced to CMS, and we're one of the first states in the nation to do this, a request to include in our state plan a service called behavioral support aids that will actually have aides that come out to families' houses based on medical necessity to help with those services up until the age of 21. CMS is reviewing that right now. We are trying to do a technology expansion to increase assistive technology in the waivers. We're doing many workforce development training issues, whether it be certified nursing assistant training or providing additional intensive family support dollars. We are doing a rate study on the DCH side for the elderly and disabled waiver and ICWP waiver. Likewise, we are doing a rate study that is underway for the now and comp waivers, as well as for mental health services. This may be surprising to you all, but we haven't done a rate adjustment for mental health and addiction services in Medicaid since 2008. The last time those folks got a rate increase was 2008 for behavioral health services. So likewise for now and comp, it's just as critical in behavioral health and addictive disease services that we get a rate study in to see what those providers should actually be being reimbursed at. We also did a 10% rate increase for the Georgia Pediatric Program. So that's in-home skilled nursing for children as well as personal support services for children. And finally, we look to do a supported employment pilot with the Department of Behavioral Health and Developmental Disabilities. So that's what we have the $191 million allocated for at this point. But again, that is totally, it's very flexible, and we can update that on a quarterly basis. I don't know if you guys have any questions, I'll be happy to answer them.
Actually, could you give an update on the rate increase for direct service providers
In the now and comp waivers? Okay, yeah, sure. So I know this is something that we've been talking a lot of the last couple of weeks on. So DBHDD, there's two different rate increases. Let me say this. There's a 5% rate increase for all services, and then there was an additional 2% rate increase that was allocated by the legislature. As of, I think it's Friday, we will have all of the prior authorizations. Tell me if I'm wrong, but the 23rd is in my head for PAs. Thank you. I have to check because sometimes I say things really confidently and I'm like, well, should I have been that confident? So Friday the 23rd, we should have all the PAs updated for the initial 5% rate increase. And then at that point, what we'll do at the Department of Community Health is we will begin a mass adjustment to pay out providers back to July 1st for when the rates went into effect for any claims that were paid at the less amount, and you will receive that money as part of a mass adjustment. Now, I don't know how long that is going to take at this point. That is something we have asked the GAMA system, the Georgia Medicaid Management Information System, the system that does claims processing. We've asked for it to be their top priority, and we've asked for it to be expedited as much as possible. And they're supposed to get us a timeline about how long that will take. We did a similar thing in the elderly and disabled waiver, and we have been successful in getting them all their claims mass reprocessed. And folks did get all of their extra money that was initially allocated by the legislature. Sure.
We're going to add a speaker into the agenda to give Representative Katie Dempsey a chance to say a word. Where should we put her? Oh, yeah.
I feel like I should turn around and speak to them too, actually. I just wanted to say welcome as well. Okay, yeah. Well, I don't want to mess it up. I just wanted to say thank you for coming to my hometown. If I hit every traffic light, it would take me 3 minutes to get to my house from here, so thank you. You are going to hear, I think, today in this very important conversation that y'all know I've been very engaged in for a long time from some of the most engaged providers, families, and individuals as well who need these services, who are receiving services too, and who have turned around lives that speak to that ability, Senator Albers, that you spoke of. There is great ability in this community to find ways for people to feel that they are having meaningful days and meaningful lives. I want to point out one thing too. There are a lot of job opportunities here. Many in the room have availed themselves of them. But one particularly, as you came in, I see the iced coffee around the room, Java Joy. That's ESP. And this year, I want to make sure that the Senate knows that they are in our budget. So we were able to help fund not only the original program from Athens, but 5 sites around the state that are starting. And one of them is right here. And it has been a life changer. So I want to say thank you, and I wanted to make you aware of that those young people out there working are so engaged and so part of our world. Thank you so much.
They give great hugs, too. Okay, next we have Cindy Levi with a Avita Community Partners.
Okay, where would you like us to go? Ask her.
Right. Ah.
Okay. Good afternoon, and thank you very much for this opportunity. I really appreciate it. My name is Cindy Levi, and I'm the CEO of Avita Community Partners, one of the community service boards, or CSBs. The CSBs were formed in 1993 through legislation to be the state safety net providers for mental health, substance use, and intellectual and developmental disabilities.
Hey, Cindy, are the folks behind you
sir.
going to speak, or do you just want them to hold up what they have?
No, they're speaking.
They're speaking. All right.
Yes, they are, sir. Thank you. I'm also representing the Georgia Association of Community Service Boards, which is the network of all of the CSBs. I began my career over 40 years ago as a direct support professional, and I'm very proud of that. It's some of my most memorable times of my life. And when I started, I had a group of 6 individuals that I was responsible for at any given time. I had an opportunity to take them out into the community to get engaged in their communities. Also had access to a wheelchair accessible vehicle so that we were able to transport those that needed that assistance with their mobility. So that was over 40 years ago. Have come a long way since then. But would like to make a point that 40 years later in Georgia, we're at a point where we still have a 1-to-10 ratio, and there are providers that are struggling to have what they need to be able to support the individuals. But we are a CSB, we're very proud of that, and the CSB is me. Next is Sabrina.
Hi, I'm Sabina. My favorite thing to do is get a job, actually. It's my favorite thing to do is help other people to get, it's like someone needs my help, I will help them. I'm like the help, I'm a helper, okay? I like to do nails, and I like to help them clean the floors and stuff. Or, what was I gonna say?
At the hair salon.
In the hair salon, that's it. I'm not a very good speaker, so
You're doing great. You keep going.
I know what, it's my speech, but sometimes if you don't understand me, it's like, slow me down. What is it? What else is that there? I mean, like,
That's okay, you were going to explain what you did at the hair salon.
yeah, it's like I had to, like, those little towels. I think let me say towels because that's one thing I can say, but I can remember what you call those other stuff. So, well, it's like I like to do stuff like that. So I like to help.
And you got that job as part of the supported employment
Yeah,
program.
yes, that is a part of it. But you beat me to it though. And you have me with this part though. The CSB is me.
Thank you. Say your name.
My name is Morgan. I am. What I want to do is get a job to be. I don't know. I like to be new garden.
Go ahead. Hold up your sign. The CSB is me. Thank
All right.
you.
Hi, my name is Amy.
Go ahead, Amy.
I don't know what I'm saying.
You wanted to share what was important to you.
Mrs. Help. Everything is wrong.
Relationships?
Yeah, it's wrong. That wrong, I say.
Okay, go ahead.
My name is Alan, and what is important to me in my job
What do you
Longoy, Yale, and the KP and me. I'm Tony Tapis.
Your name is?
Tony Tapis. I'm a job. I'm a people working to watch Flash. I'm me.
I volunteer at a food pantry 1 day a week, and that's what's important to me, right?
My name is Misty Morris. I've been working as a DSP for almost 4 years now, and I really do have the best job ever. I really do. In the time that I've been working with the Vita, as much joy as I get from the job itself, I do see that there are things like the ratios that are problematic. And while we try to do the best we can, we could give a much better, we could provide better services if things like the ratios were smaller. Because you can imagine having people who need more support and then 10 of those going to a restaurant, it can get really complicated. And I know that like at our center specifically, we have a lot who like they want to go like hiking or to places where others just don't want to go. And with lower ratios, we could provide those services and give them more opportunities to do more fun things that they enjoy and that enrich their lives.
Thank you very much to our team. I really appreciate that. Just a minute yet with regard to the rate study, because that's a hot topic right now. Brian made reference to it, and we really appreciate the opportunity to provide input into that rate study. It did take a lot of time. I know for many of the comprehensive organizations, it was over 40 man-hours worth of input into an Excel spreadsheet. So that is greatly appreciated. However, I would like to emphasize that you cannot document the humanness involved in the work that we do on a spreadsheet. So it's very important. Thank you. So there's more to it. And so the request and the hope is that in addition to that documentation on the spreadsheet, that there would also be the opportunity to provide verbal input as the process continues. And also looking at what was called the exceptional rate or additional staffing process is very important because the process as it stands right now is extremely cumbersome. And justification of continued needs several times a year is also very burdensome whenever you're looking at something like, for example, an individual that is incontinent and requires additional staffing to assist them with those needs. It's not going to change several times a year, so that's just an excess burden that is on the employees. So thank you very much. Obviously, leave a lot of time for folks to say things today. Thank you.
Thank you. I want to take a moment to recognize online one of our committee members, Senator and Dr. Dean Burke from down in Bainbridge, Georgia, is joining us as well. So he'll be listening and participating in the committee. And now we've got our last speaker, signed up before we go to our sign-up sheet.
The last speaker is somebody very special to me. He's a constituent, lives in North DeKalb County, and contacted me at the beginning of last session about wanting to work on this issue. And he just woke up in me that I had worked on this issue before, years and years ago, when my babies, who are now 21 and 22, were babies, back in 1999 through 2005, shortly after the Olmstead decision. And then we had a whole campaign called Unlock the Waiting List, because there was already a waiting list. I left politics to raise my own kids for 14 years, and then came back in 2018 and was devastated to find that there was still a waiting list. And so my constituent Philip Woody's phone call was very timely, because he wanted to do something about this, and so did I. So this session, he and I were connected at the hip. Whenever I needed somebody down at the Capitol to speak to a committee, or to speak to a staff person, to speak to anyone, to tell his story, I could call him, and he came down to the Capitol and really, really made a difference in the outcome that we had at the end of the session, which was to have over 500 now comp waivers funded rather than 100. So he was sharing with me some of his thoughts this weekend, and I said, Philip, you really need to come to Rome and say those words to the committee. He wanted to be here at our last committee meeting, but I think he had COVID in the house, so we're gonna hear him in Rome. Thanks.
Thank you, Sally. And it's been an honor to work with you and to impact the lives of 500 additional families last year. So that's fantastic. So first of all, thank you, committee, for allowing me time to air our thoughts, expectations, and concerns about the support of the IDD community in Georgia. And I'd first like to start, John, by saying congratulations for being on the best dressed lawmakers list of 2022. A truly bipartisan selection, so congratulations there. I envy you. All right, so I've talked several times to many of you in the past, but as a reminder, I'm the father of Evan Woody, who is 23 years old, who suffered a traumatic brain injury at a year and a half, lost 20% of his brain, crushed his brain stem, leaving him today with a 3-year-old equivalency. He's nonverbal, ambulatory, and we do all of his ADLs, bathing, dressing, shaving, toileting, etc. With all of that, Evan is a great young man who has blessed so many people over the years. I echo several of Diane Willish's and Heidi Moore's statements from the last meeting, and I obviously have more to add. The first critical point is that addressing the priority of the DSP crisis over waivers or vice versa is the wrong approach. Both of these issues are equally important, and the state needs to fund them. It needs to fund them all of the available programs. We as a community have taken small concessions for the past decades, and we need to be thinking bigger. Even 513 waivers in a year is only addressing 5% of the population waiting for waivers, 95% still waiting for services. With respect to the waivers, we'd like to see the number of waivers from last year doubled. It's my personal goal, but we'll see what we can do, and we have to set lofty goals. So 1,000 waivers versus addressing the DSP crisis, it's not an either or. You'd have hundreds of incredibly upset waiting list citizens and families if we told them they would have to wait years longer for a waiver until the DSP issues were resolved. My family would have been one of them. And at what point would the DSP issues be considered resolved before the focus would revert back to the waiting list again? 1 year, 2 years, 3 years? And I can tell you that a lot of families felt like ours in that while waiting for the waiver, we began to feel hopeless, that Evan would never get the waiver, and DBHDD told us that verbatim, and that we would have to save literally millions to make sure Evan was covered through his last breath. My wife was literally on the verge of a nervous breakdown, stressing about whether Evan would get the waiver and having to save millions for him. I would stress about the waiver several times a day, but I'd remind myself that Evan needs me. When we received the waiver, it was a huge relief, and still is, although we now experience the issues of support staff and a huge lack of programs for Evan. It's important to note that if added to Governor Kemp's budget, not all 1,000 persons receiving a waiver would use state-directed services. Many would self-direct, like our family and like a lot of people that Lisa and I know, giving themselves a greater pool of support staff candidates and more flexibility to pay a viable DSP wage to quality support staff. And on a tangent, there are dozens of people I've spoken with, and I'm sure hundreds more around the state, who haven't bothered to apply for the waiver because they believe they'll never get it. So there's also a discussion about day programs versus work programs for Georgians with IDD. One position is that from a policy standpoint, people with all types and severities of impairments can work. Another position raises that not all persons can effectively work with the proper support tools and customizations, and as such, that quality accessible day programs are needed. A recent quote from a friend with a son with autism. My son was working at Barnes & Noble's with his day program, so with support. He decided instead of working, he would just sit there and read. When his teachers tried to get him to work, he started running around the store, trying to hide, and then knocked over a display. Trained support people couldn't even contain him. I can't fathom him being left to his own devices at a store or workplace. Is that my... Okay, all right. By definition, the Georgians with special needs all have unique needs and support requirements. I estimate that 1/2 of Evan's high school self-contained classmates would not be able to realistically hold a job, and they would have the same experience as the quote above. Evan was in a transition work program in high school, and from a practical standpoint, it was a disaster. Work programs replacing day programs is not the answer. There needs to be both. There may be hundreds of day programs in Georgia, but not all are right for the individual. It took us over a year to find a day program that was right for Evan and that would accept him. He was kicked out in 2 weeks because he was not a fit. Evan and I have a friend with special needs sports who lives in Stone Mountain whose mother has to drive 45 minutes each way to and from the program each day. There may be a lot of programs for higher functioning individuals, but not for those with severe needs and who require full ADL assistance. As for family members as direct service providers, Appendix K needs to be made permanent, as similar programs are in 16 different states in the United States. Family members need to be paid, especially while there is a DSP shortage and crisis. Family members are more dependable, have a vested interest in the individual, are more capable, and understand the individual's needs better than anyone. It's been a need before COVID and will be a need long after COVID is quote unquote over. As a parent advocate, we shouldn't have to look, as a parent advocate told me recently, we shouldn't have to look to move out of our state to get the care we need. As a matter of fact, a parent on Facebook who recently moved to Georgia lamented over the lack of services. A great percentage of the 100 comments for that post said, move to another state to get services. Granted, there were suggestions of established programs, but most are what I call point solutions or point programs that offer events versus long-term services. And as far as the issue, as far as this issue being bipartisan, the facts speak for themselves, and I'll lead into this by saying that I'm a conservative and I'm a Republican. For the past 3 governors, the most their legislatures have funded for the waiting list in any given year is 5%. And it's a fight every year to get what we get. DSP wages have remained artificially low for over a decade. 15 senators supported Sally's bill to fully fund the waiver waiting list 2 years ago. All were Democrats, no Republicans. I'm a conservative, but if this is indeed a bipartisan issue, both Republicans and Democrats have to come to the table. The bottom line on all this is that whether the topic is the DSP crisis, waivers, day versus work programs, all need to be addressed and made priorities. The state has historically underfunded all of these programs and given tax refunds while the need gets more urgent, and that's where the fight needs to be. To fix inflation, the government uses all available tools, including interest rate hikes, reduction of the money supply, and price controls. We need to demand that all of the programs available to Georgians' IDD community be fully funded, and if they aren't, we may need to look to legal action. Families that I know, number one, want off the waiting list and to have waivers. Two, want more and better day programs along with the opportunity for, if appropriate, work programs. And they want the DSP crisis addressed, including permanent family caregiver support staff compensation. We're tired of fighting, but we'll keep fighting the good fight, and this is the good fight. And that's my 2 cents.
Thank you. Okay, so here comes the time that I got to be a tough guy on speakers. So we've got 26 people who are signed up to speak, which means everybody's going to get 2.5 to 3 minutes tops. So in order to make sure that everyone gets the opportunity who wants to speak, be heard today, who is signed up, I'm going to ask for your help. Prepare your remarks to be clear and concise. We also have a website that if we can stick that website back up, you'll get to see where if somebody is listening online or you're not comfortable in front of a microphone and you want to send that to us, we're capturing all that information together, and that will be a part of our recommendations and output. When you hear the little chimes in my phone, though, I'm going to ask you to wrap up, and what we're going to do is Senator Harrell and I are going to give 2 names at a time. So the first person's going to come up and talk, and then when the next person comes up on deck, we're going to give the next names. So if you would, just get yourself prepared so we don't lose that time of people coming in and out. And I want to recognize one person before we begin, and it's Ms. Ryan Miller with the Georgia Hospital Association. Ryan, please stand up. She does a great job representing all our hospitals throughout the state of Georgia. Give her a round of applause. So our first person is going to be Stephen Hunt. If you'll come up to the microphone, and on deck we're going to have David Lamb.
Hi, I'm Stephen Hunt with Briggs & Associates. We do supported employment, and we have been in Rome for approximately 8 years, I want to say, and we have been able to just match some of the greatest people in employment of their choice and support them on those employment. And one of the biggest things that I find as we match people with employment, there are many people who wants to work and cannot get to work, as transportation is like a very big issue in this area. The truth is nobody lives on the bus route because there really isn't any bus route. And for that reason, there have been like strain on family members, and people tend to we have to get real creative for people not to turn down good employment, but sometimes it's just not possible. So like I said, this is a barrier that we would like to see some adjustment. We have gone where at one point I was told that there was a bus system here, but the bus system runs from something like 9 to 2. And that's not work hours. So it's just a major issue. But we have so many people just want to get out there in so many different industries that we support people. People are with several different kinds of disability. We treat everybody as individual. Everything that Briggs & Associates does, we do it in the community. In fact, we don't have a standing building as an office. Our office is our cars, because all we do is employment, and we understand that employment is something that if we are in an office sitting down, then we are not talking to employers. And if we're not talking to employers, then we are not getting people jobs. So we take ourselves in the community and we make our cars be our office as we perform these services. And we talk about rates, and I get excited when I hear we talk about rate adjustment, for the simple fact that, especially over this pandemic, we were competing with, and I'm wrapping up, we were competing with like McDonald's, and nothing is wrong with McDonald's, but in order for us to have good employees, then we have to have good salary. And sometimes we have to watch good employees go because we cannot afford to keep them because of the rate that we are paid. So rates adjustment would help us to do so much more for these individuals who deserve so much. Thank you.
Thank you, Stephen.
Thank you. The next person on deck is Linda Mincy. If you could come up and be ready.
I'm Dave Lamb. I'm with CareMaster Medical Services. We are a private home care provider located in Griffin, Georgia. We serve Medicaid waivers, not now in comp, but the elderly and disabled. We also, on our private duty side of the business, specialize in spinal cord injuries, traumatic brain injuries. Our CFO happens to be a quadriplegic that is in his 37th year. So it's the discussion is very important to us today. The Home Care Association of America has more than 4,000 provider members. I just come from Orlando Monday, where we had a national conference. Workforce was the conversation, and it's already started here. If you look at the state and look at our population, roughly 2.6 million Georgians are the category of elderly and disabled, or 1 in 3 adults. And of the elderly, we know that 50% of those folks are going to need care. We also know that more than 400,000 Georgians are receiving some type of paid care in their homes. Workforce means continuity of care. And unfortunately, now workforce issues mean the lack of continuity of care. We can't not address it any further. Now, the legislature were very gracious to us in the FY22 and the FY23 budgets, giving us increases. Unfortunately, we started that process on a 20-year behind $8.27 an hour. Looking at the projections for next year, we're going to be behind over $10 an hour between inflation and rates. Our waiver programs need similar reimbursement rate structures because we all draw from the same workforce. My suggestion, and I'm glad to see Brian's here today because he's heard this from me before, but our caregivers need to be eligible for Medicaid. Put in a requirement, anything over maintain 30 hours and be eligible for Medicaid. A lot of them have children that are. Offer that type of benefit. Somebody was talking about just now, competing with fast food. We have seen since the year of the pandemic, some of our competition, especially in retail, have increased their entry-level rates of pay $4 an hour, where our rates have increased roughly $2 an hour. I've got a lot more information. I'm going to leave with you both co-chairs. This is the state of Home Care, the Home Care Association of America.
Thank you.
And look forward to talking with you further.
Thank you.
For what you do.
Okay, on deck we have Robin Davenport.
Hello, my name is Linda Mincy. I have a special needs son that's 38 years old. Not only is he special need, he also has seizures, so epilepsy. I just moved, my family just moved here from Florida a year and a half ago. My son was on the waiver there for 15 years. I was on the waiting list for 5 years when I was there. So I did my time on the waiting list. So now I'm, moving to another state, it's challenging. But when you're moving to another state with a special need person, it's more challenging. So now I'm empowered. I feel good because there I got all the support, a support coordinator, someone to come to my home, someone for my son to call when he feel like he just want to talk, enclave programs, all of these things, quality of life, dignity. But now I moved to Georgia and everything has just blown up. I don't have that support anymore. Now I'm thinking I can move my waiver to Georgia, and that is not true. They're telling me, oh, you got to go on another waiting list. Now, how you think that makes my son feel? So now he think, what have I done to be sitting home, twiddling my thumb for a whole year? Where is the dignity in that? When we take away things like that from the special need, they do not feel good. For them to go out and do support employment, for them to have access to the community, just to be around people of their specialness makes them feel good. Now he's sitting home doing nothing. I applaud Floyd Training Center because they pulled me in and he's there for 2 days. But if that program is not funded, he cannot go there 5 days a week while I wait on a waiting list. So what do I do with that? He has 3 days there to do nothing. Something has to be done about that. The special need and the disabled should not be a second thought. We should not be a second thought to say, oh, hey, the waiver, the special need, oh, we forgot about them in the budget. That should not be. We are people too. We are families that need that support. Our special need, our sons and our daughters, we need that. So if you can, just take the time and get that list and say, oh, okay, that 5-year waiting list, we have to break that down some. We have to break that down. I don't know, I'm caller number what? 2,000? I never even hear back from the waiver. I don't know what number I am because nobody writes you and say you're number 500 in the waiting list. I feel like I'm caller number 2,000 because I don't hear anything. Please, let's make a difference in the waiver.
Thank you. On deck, we have Jason Cook.
Hello, my name is Robin Davenport. I'm the director at Mineral Springs Center in Blue Ridge, Georgia. We serve Fannin, Gilmer, and some Union County folks. March 2023, Mineral Springs Center will celebrate 50 years. It'll be our golden anniversary that we've been providing services to adults with developmental disabilities. So we're very excited about that. What I wanted to bring to attention today, and is dear to my heart, is the DSP workforce. Last week was DSP Recognition Week, and we celebrated our DSPs at Mineral Springs Center. We're very thankful for them. I do want to bring out some facts about Mineral Springs Center with what we can pay. We are currently paying our DSPs an average of $10.75 an hour. Now, I have 2 granddaughters in our area, and we're a tourism area in Blue Ridge. They are 15 and 16 years old, and they're making $12 and $13 an hour. So that is very discouraging when we can't pay more than that. This time last year, our staff was making $8.69 an hour. The only way we were able to raise them up was to do away with health insurance. So many of them were able to go to the marketplace, and it was, a good option, but not all. You have to make a certain amount of money in Georgia to be able to qualify for Medicaid. So some fell into that loophole. So that we would love to be able to raise the wages of our DSPs. Another thing I want to bring to the attention is the 5% rate increase. And Mr. Dowd, I appreciate you addressing it because we're not hearing anything. We heard on August the 11th from Ron Wakefield that he assured us that lump sum money would be in our account by August the 31st. We made plans with that money. We went ahead and gave a 5% raise to our staff, and we bought a much-needed van that was about $18,000. We still don't have that money. We still don't have that lump sum money. We were told a couple of days before the 31st of August that some things had come up unexpectedly. It would be September 14th. It still was not there. We have heard from no one until today as to what the status of that is. We have to make projections for our budget. We have to have a balanced budget. So if that could be addressed, we would appreciate it. Thank you. Thank you.
Next.
Hi, my name is Jason Cook. I've been going to Cross Plains Community Partners since 2007, and I have enjoyed my time there. My Medicaid waiver has really helped me, and it supports my mom who can't take me everywhere. Number one, I work 3 days a week for the Dalton City Parks. I get paid so I have money to spend the way I want. Number two, I choose to do many fun things in the community too. I make my schedule, and Oscar helps me go to the movies, out to eat, to the aquarium and IMAX, Lake Winnie Amusement Park, baseball games and concerts, and even autism walk. Cross Plains has helped me learn leadership and self-advocacy skills. I serve on important committees, quality enhancement, human rights, and self-advocacy. I used to serve on the boards of directors. Thank you for allowing me to speak.
Okay, next we have Elizabeth Hunter with Jim Givens on deck. Is that right?
I'm Elizabeth, yeah. Good afternoon. Thank you for the opportunity to make comment. My name is Elizabeth Hunter, and I'm currently leading Cross Plains Community Partner, an organization serving men, women, and young adults in the Northwest Georgia community. I know that you have heard much about the staffing crisis, especially in direct care, and the many stories of how this has impacted people with disabilities and their families and providers. All of this not only impacts those currently in service, but it also means that this opportunity for the 500 waivers that we just talked about will probably not be used the way that they should be. Just because you get a waiver doesn't mean you actually have a provider to provide that service. The other item I would like to make comment on is the lack of innovation, and that services are pretty much delivered in the same way that they have been for years. The hundreds of policies, rules, and regulations and multiple duplicate audits suffocate innovation at the provider level. I realize health and safety and welfare are number one and are absolutely fundamental to the services we provide, but at some point there has to be a balance so that we can move forward and do good things for the people we support. Many young people with disabilities exiting the school system want to go to work. This isn't hearsay. I've witnessed it personally and seen many young people who graduate and are able to become awesome employees within their community and give back. They are living their best lives because of it. We appreciate the work that DBHDD has invested over the last several years into the employment initiatives. However, the lack of information for families to access as they are transitioning out of school is a huge problem currently in this system. And that would include people for supported employment as well as day services. This means that many high school graduates go home and sit on the couch, and instead of going to work or participating in daily life, they are sitting at home and not engaging in anything. We have to rethink our system. We have to remove barriers so that all people can have equal access to their communities and allow providers the room to be innovative and think outside of the box without the entanglement of policies and regulations, as well as the adequate funding to do that. Thank you for the opportunity to speak.
Next is Jim Givens. On deck is Barbara Monday.
I'm Jim Givens. My address is 16 Commerce Court Road.
I brought my daughter with me today. She receives services at Network, and I've gotten her a little off track, and you know, when you get them off track, it's hard to get back on track. But she's here, and Rachel's beautiful. All y'all are going to say that. The reason for that, she looks just like me. I'm here today to talk about an issue that's not covered by this committee. I know it's not under your purview, but I didn't know where else to start. And that is, Rachel was educated by the Floyd County Board of Education beginning at the age of 4 to the time she was 22. During that process, she had psychological evaluations on an ongoing basis throughout that period of time, as you all know. However, when my wife and I decided we wanted to get legal guardianship of Rachel, we knew we had to go through the probate court, and in order to do that, you have to hire an attorney. Costs somewhere between $5,000 and $10,000. All that information that the school system had obtained by licensed psychologists, psychiatrists, and other trained professionals just kind of went out the window. It don't exist anymore. So now you got a system that is asking a parent of a mentally handicapped adult who has been declared that way for many years to go and hire an attorney at a rate of $5,000, $10,000 rather than just letting them look at the past records of that child, that student, that adult now, and say, you're right, this child is mentally incompetent. So I'm just wanting that to be passed on to whatever legal committee it has to go through to see if there can be some correction introduced in the legislature to correct that, to where the judges would be given discretion just to look in that patient's file, that individual's file, and make a decision without the lengthy and more expensive legal system and attorneys. I know numerous parents that have not applied for legal guardianship. They just don't have the money. It's that simple. But the state has already obtained that information. We would call it a duplication of services, but that's kind of a stretch. But I appreciate your consideration.
Thank you. And I'm going to ask Jocelyn, our Senate Research Office, to please look that up with Legislative Counsel so we can work on a solution for that for you. Thank you, and great job, Rachel. Okay. Next, after Barbara, we've got Jenny Dalton, and then Jacob Allman after that.
I am Barbara Monday, and I am a retired SLP for the Floyd County School System, so I know these kids in one way, and I have a son who is 47 with developmental disabilities, so I know the kids another way too. I'm a founding member of DIGS, and you should have one of our brochures there in front of you. It was started by parents, grandparents, brothers and sisters who had adults in their family with disabilities, as well as some special educators. And our concern was what will happen to them after we die. And we checked into things that were available here in Floyd County starting back in the early 2000s. We didn't find anything that we felt was suitable or what we wanted for our adults. So the conclusion was we'd have to do it ourselves, and that's how DIGS was born. Our mission is to provide safe housing, work, and leisure opportunities for adults with developmental challenges, and that's what we go by. We realized that getting the housing would take the longest and be the most expensive. Work is a whole nother issue that involves supportive employment and all of that other people have already talked about. And leisure opportunities, we have the choir, a dance club, a camera club, an art club, and a group that works with social skills for adults with autism. So they have leisure opportunities, and we have built 2 homes so far. Our biggest issue with our last home was that it was finished in April of 2000. And we partner with Developmental Disability Ministries out of Norcross. None of us knew how to run a community living residence, and they do. They provide the staff and run the home. When our second home was finished and we applied for the license, that was in April, and we were told that by June we should be able to get the license. it was over a year past that April, in June of the following year, before they decided they could come and do, excuse me, through the computer and just do an inspection that way rather than coming in personally to the home, which was wonderful, but they could have done that in April of the year before. We need the support. We want to do it ourselves, but we need the support with the waiver. And it's what Philip said, what the others are all saying.
Thank you.
Okay, on deck is Jacob, what's that, Allman, and then Antoine Posey.
Good afternoon. My name is Jenny Dalton, and I come to you today to ask for help in two very important areas of my life. First, I'm a resident of Chattooga County, where I'm a deputy at Chattooga County Sheriff's Office. I've been in public service for 21 years. In those years, I've seen many occasions where law enforcement has had contact with individuals who have varying degrees of developmental delays. For many years, I watched fellow officers navigate the encounters the very best way that they knew how, with what few resources and limited training had been made available to us. Our sheriff, Mark Schrader, saw the need and had our SROs trained in TBRI, otherwise known as trauma-based relational intervention. I think it is something that should be instructed to every law enforcement officer. People who come from hard places and those with developmental delays often go hand in hand, and the techniques used make such a difference in the encounters that you have. There are many resources available, but when you're on limited budget, as many of the more rural counties are, the ability to provide those resources for officers to be better trained and actually provide information to those who are most at need that we are sworn to serve are often reprioritized. I serve as a part-time SRO for a local charter high school, and the majority of those students are somewhere developmentally delayed. They do not perform well in normal learning environments. They cannot attend normal classrooms. And while those needs are important to me, I also want to touch on briefly my 5-year-old son. Jensen was born in March of 2017, and at the age of 3, there were certain behaviors that I knew instinctively seemed out of place. Jensen did not play like other children. He would get overstimulated. He couldn't run like other children. I'd hoped, since he would be starting school soon, that he would see other children and be able to emulate that activity, as he did not have siblings in his home that were of similar age that he could learn from. Jensen began the pre-K program in August of 2021 at the Somerville Montessori School. In less than 30 days, Jensen was dismissed from that school for his inability to participate in group learning and his inability to transition from activity to activity. When that occurred, I was told that the pre-K classes for the county were all completely full. He did have the ability to attend PALS 2 days a week at 5 hours each, that provided some learning environment and therapies. But we were sent out of town and overnight for additional therapies because these rural counties do not have the services needed for children with developmental delays. We were waitlisted for a year for a diagnosis. Now we're waitlisted for all the other services as well. This has to change. This has to change. On behalf of deputies across the state of Georgia, we need help. We need help to be able to help those who are most in our need.
And thank you for your service.
Good afternoon. My name is Jacob Allman. I'm the Executive Director for Floyd Training and Service Center here in Rome. Been here since 1972 providing services across the spectrum. Hey, Antoine. So first, I'd like to thank you for your time for coming. This is a very important issue, as you heard from most people already spoken, and as you'll continue to hear throughout the day. As a local provider here in Rome, we range from varying needs that we serve, from people with high intellectual disabilities with many medical fragile needs to very high functioning and very independent in the community. I want to briefly speak to you about the issues that I navigate with families on a regular basis through our current system. I personally assisted families with trying to access services either straight out of the school system, just moving to Georgia, or having to come in with major life changes within their family household. The waiver process typically takes months or longer to get through the required paperwork, and if they're not considered urgent or high need, they then go on to the waiting list. Most of the individuals that I encounter are simply seeking day service supports or supported employment. That's why they're considered not most in need. However, they don't typically get into services unless some event happens in their household that rises them to the level of urgent. Simple financial commitments from the state would help resolve some of that issue. I heard Senator Harold Albers talk about that last committee meeting. That would be a great support to providers, is just simply putting the $100 million or however much that comes to, because at the end of the day, that is typically what the waiting list is waiting for, is just minor day support services. Lastly, if budget restrictions were removed, the next issue would be having to and maintaining enough staff to meet the needs. Of course, the provider network cannot afford to support 7,000 people on a waiting list currently. And with the staffing crisis currently, that would be exacerbated by that. So we have to address the elephant in the room, which is staffing wages. We start out most of our staff between $10 to $12 an hour. We cannot compete with general retailers in the area. From Target to Walmart, they're paying anywhere from $15 to $18 an hour, some $20 an hour. Lastly, we still have not received the 5% rate increase. I realize Brian and Ashley have spoke to that, and that's been a hot topic for several months. Frankly, roughly about 15 months that we've been waiting on that. Those funds, however, COVID has blown this out of proportion, has made it very difficult for providers to compete in the marketplace, to the point where we're putting people's health needs at risk. So as you guys continue to go through the state and have these discussions, we much appreciate your help in supporting providers, supporting families in Rome, Floyd County, all throughout the state. Lastly, I would like to talk, as this is Direct Support Professionals Week, declared by Governor Kemp, but I'd like to kind of shine some light on what he describes as what a direct support professional does. Direct support professionals must build close, respectful, trusted relationships with those for whom they work, requiring compassion, empathy, and the highest ethical standards. Direct support professionals must assist and manage medical and behavioral health needs, help people with communication, and provide intimate personal support daily. Georgia's direct support professionals have historically provided for the health and safety of our citizens with intellectual and developmental disabilities. Thank you.
Thank you. On deck, we have Ms. Green.
Good afternoon. My name is Antoine Renard Posey. I have been receiving services from the Floyd Training and Service Center since November 16, 2009. The past jobs that I worked are Buttercup Boutique, Action Ministries, and Harbor House. Now I'm working at Studio Series, Sexual Assault Center, CPA, Java Joy, and Heather's Outdoor Power. I like to volunteer Community Kitchen, Food Pantry, and Angel Express. The staff and my support coordinator have all support me to help me maintain my jobs. I love going to Floyd Training Center, and the staff members are great. I am very independent and advanced.
Okay, on deck is Tiffany Abbott Fuller.
Good afternoon. My name is Lucretia Shante Green. I have been receiving service from Floyd Training Center since March 2018. I feel that I have become more confident in things that I do. I am now working at Harbor House and Java Joy, which I enjoy so much. I also volunteer at the Community Kitchen, Food Pantry, and Angel Express. I love the experience. The staff and my support coordinators have all worked very hard each year with me to be to be sure that I met my yearly goals. I love going to Floyd Training Center, and the staff members are great. Thank you.
Okay, on deck is Brandy McConnell.
Good afternoon, senators and committee. My name is Tiffany Abbott Fuller, and I live here in Rome, Georgia, and am an active voter and taxpayer. I'm also a public school educator for Rome City Schools and have worked in the inclusion classroom for 20 years. I'm also the mother of 3 young boys. So I'm here today to advocate for change and improvements to the now comp waiver. My 2-year-old son, Quentin, who is not here with us today because it is Disney Character Day at his full inclusion daycare. So here's his picture. He has Down syndrome and Klinefelter syndrome. So together with my husband, we are raising Quentin to be independent, socially active, and an involved citizen. With this in mind, just as I currently want him to have the best and medical care providers, I also want the same top-notch support for his future. One way to ensure a successful transition into and throughout adulthood is to pay DSPs competitively. As an educator, I know the value of building relationships with students and the impact it makes on their academics as well as their well-being. For my son to continue to thrive, he should have the same right to a dependable and qualified support personnel that aims to build a relationship and support my son in its fullest. This change isn't just for Quentin and his near dozen friends of close age here in Rome and others in the disability community, but also for the current DSPs and their families to stay in a relevant and needed profession, a profession that, quite frankly, my son's future may well depend on. I stand before you to represent the future individuals who deserve this right and this comfort. Thank you.
On deck is Debbie Sneary.
Hello, my name is Brandy McConnell. I'm the Executive Director at the George Chambers Resource Center located in Calhoun. I've been at George Chambers for 20 years, and the majority of our staff have been there for 10 plus years. One of our ladies has been there 47 plus years, and we've been in business for 52 years. My thing that, and as a parent of a child with a developmental disability, is, as everyone has spoke about, is the waiting list. I've always said there should be a liaison between the time students transition from high school to whenever they're going to enter the day program, because you have that gap where nobody's in contact with anybody. The families are contacting the day program that they know that's in their community. However, we can get in touch with the regional office. However, there's a stumbling block because you have to have a release of information to be able to speak for that person, even though the family is contacting you to see can you get them information on getting them into services. And so that's one of the big pieces that keeps our guys from getting the supports that they need. And also, as a provider, we end up paying more money out of pocket for certain trainings and things that we need. However, if that was already included in funding, then we could provide more pay for our staff members, and also with accreditation. We have Clarent that comes through that does quality improvement to see if we're doing what we're supposed to as a provider. But then in 3 years, we have to pay an outside entity between $7,000 to $14,000 to review the same services that somebody has done year by year to see if we're doing what we're supposed to do. So those are things that we need you guys to look at and be like, well, if we already got this and we're already paying for it in Georgia, so why should we have to have these providers pay somebody else out of pocket and we're already paying for it? And so that's all I wanted to say, but thank you for your time.
On deck is Dina Payne.
Good afternoon. I'm Debbie Snary. I'm a recently retired physical therapist that has worked in Northwest Georgia for 44 years. The last 21 years, I've worked in the public schools with children with special needs. I have also served on 4 different community boards and currently still am on one of organizations that work with adults and children with special needs. And in the opportunity I've had to work in this field and serve on these boards, I've encountered many families who are weathering the challenges. As we've heard today, I'm just going to be reiterating what we've heard, that there's difficulty finding medical services, respite services, equipment, supplies, transportation, transition, and of course, access to funding for all of these things. There are stellar programs out there and good work being done, but it is often up to the families to fight their way through this system, and this is on top of the emotional and financial stress of caring for a loved one with disabilities. I also have a person in my life, my brother-in-law, who is now 67 with severe intellectual disabilities. Sean lived with his parents until their age and his desire to be more independent came together to allow him to move into a group home in Middle Georgia. He has since come to live in Northwest Georgia to be closer to his brothers and to receive services up there. His day services have been remarkable. He has dedicated DSPs in a person-centered, community-based setting. He has friends and activities he enjoys, and he has purpose to his day and dignity in his life. Our significant challenge has been with housing. Sean is open-hearted and social and enjoys people, which is a good thing, because in the first 15 years he lived in our area, he moved from 8 different places. In the last 5 years, he has been in a host home with a family that loves him and he loves them. The role they have as direct service providers requires that they wear many, many hats. And in his aging process, he is now fully deaf, has limited vision, and is more unstable in moving around. This has not only increased his care demands, but has caused regulatory additions to the host home at the host home owner's expense. I'm going to wrap it up. It's been well established that we need proper classification of the DSP role and better pay and better supports for them to do their job. As a family member, a healthcare provider, and a sitting board member, I respectfully request that we do not add any more regulatory costs to our service providers. And also, I appreciate your comments on the 5% increase, but it has been 15 months. And we really understand that there's a lot going on there, but it's been 15 months. And there's an additional 2% that is coming due in this past July, it's my understanding, and neither of those have been received yet by the providers. I thank you for your time.
On deck is Nick Solomon.
Hello, I'm Dina Payne. I'm the Chief Operating Officer for Highland Rivers Behavioral Health. We are one of the 22 community service boards. Service board is me and the individuals that we serve. And my comment today is really going to be toward the policymakers. And Ashley, I'm glad you're here because there's been a lot of conversation lately about individuals not being able to get care that have high needs, behavioral supports, and things that are really hard to find residential homes for. And as a provider, we have 56 host homes. And one of the needs that we have in the host homes is additional residential support. And the barrier to this is that someone that provides additional residential supports has to be an employee of the provider. And when you have someone that's living in a host home, we have taken them into those homes as to be a part of that family and to be a family member and to live like they're living with like they would be living with their own family. And when they need additional supports, and we have to give them additional supports, and we have to put our staff in a family's home, the families don't like that. They would love to be able to hire their own staff, which would probably be someone in their community, their family member, to work in their home and be a part of their home and not disrupt their lives like it would be to have a direct support person from a provider to come into their homes. Therefore, when people have more needs and their needs gets beyond what a home provider can provide on their own, then they will turn in a notice on that person. And that person has to have a new home at that point. And it could be that that person has been in the home for 20 years. And so you're taking them away from their family because that family needs additional supports that should be funded and payable to that family member instead of having to come through the provider and the provider being the person, the entity that provides a person for that home. It just takes away that element of a family environment. And so I really wanted to speak to the policymakers about that because I know that that is a Medicaid guideline. And that was what I wanted to present. So thank you.
Next on deck is Jenny Sheely.
Hey, good afternoon. Nick Suleiman. I'm president for RHAL Services. Really appreciate the time and the opportunity. While I really do echo everything that's being said today, I thought it may be helpful to kind of give you a slightly different perspective from our standpoint. We've been around for about 32 years. We operate out of 4 states: Georgia, Tennessee, North Carolina, and Philadelphia, and Pennsylvania. And you know, it's just so I think there just would be sort of a little bit additive to what's being said today. So. You know, during the pandemic, I'll use the state of North Carolina as an example. They really stepped up and provided for 35 to 40%, you know, rate adjustments while they were not permanent, but just a one-time to hold us up during the pandemic. And that really helped. I mean, 100% of that was passed along to our employees. And then during that process, they acknowledged what the issue was, and they actually, if you kind of look at ICF services, waiver services, the starting wages now have gone from $10 to $15. That's been confirmed, and then we're actually working on a second tranche where we're actually going to go up to $18 an hour. So same population, same staffing requirements, so on and so forth. So you know, and there, I mean that worked out because we had both parties kind of come together with the legislative process, the advocates, the provider community, and so that's something that we constantly work on. And as an example with Tennessee, you know, there's been a move very similar to North Carolina where we've gone from $10 to $10.50 to $12.75, and there's additional movement towards that. Not that different in Pennsylvania. Very similarly, our starting wages are $16.50. So a lot of, again, no different in terms of individuals' needs, the acuity level, the staffing requirements, but ultimately in the state of Georgia, while every little bit is appreciated, 2%, 5%. The inherent problem is that we're in such a big hole that 5% is not going to get us there. So ultimately, I think certainly our biggest concern is what happens to the infrastructure. There's a lot of people on the waiting list. I'll be honest with you, I don't know if we could really maintain the system that we currently have in place. And believe it or not, we have executives from Tennessee, staff from Tennessee who actually come to Rome here to work shifts. Same thing with North Carolina. So while this is all obviously appreciated, the concern or maybe the warning is that we should be concerned about what's happening to this infrastructure. So, and to the extent that RHA could be a resource to you all, whether any kind of data points that are needed in terms of correlation between pay adjustments by region versus staffing, we have all of that. So we're happy to provide that and be a support system to you all. Thank you.
So you're saying we should be like North Carolina?
Well, maybe, right? Maybe, but what we're doing right now is not working, right?
Do you know if that extra 30 to 40% was through ARPA funding?
Parts of it were. And they got really creative around, and I can give you all the details around it. I can send that to you, including what happened in Tennessee. There's a combination of different things, but part of it, yes. It was.
Yeah, I would like to see that additional information. It's so helpful sometimes to look at what other states are doing and think outside the box. So if you could follow up with us with some of that information, that would be great.
Absolutely. Thank you for your time.
Thank you. On deck is Kenneth Crawford.
I'm Jenny Sheely, and I'm the Executive Director of Network Day Service Center. This is Kenneth Crawford. Hi. We are the old people of our business. We have been with Network Day Service Center for quite a while. Network is in Rome, Georgia, and has been here since 1954, so we're going on 70 years of service. It's probably one of the oldest businesses in Georgia. But anyway, I brought Kenneth up here because we're dittoing everything that's been said, especially about the workforce and the DSP shortage and stuff. But he is a prime example because as you see, everybody passionate in this room about how they feel, obviously, because we're obviously not in it for the money. We're in it because of our hearts, right? So I just wanted Kenneth to tell y'all, because he works, and then he has his own home. And so tell him what you do. You can speak right here.
I work at Network.
Okay. So what do you do there?
I clean up.
He cleans, and then you work on that sorting.
Yeah.
Yeah, he has a job where they sort, and his
Sweet low, sugar and salt and pepper and everything.
everything. He does a fabulous job.
Yeah.
And Kenneth also, he has his own apartment.
Yeah.
You've been there for, gosh.
I've been there a long time.
Long time. He has.
Yeah.
And he requires assistants to help him, like, what do
Take
staff
out
do
eat.
for you?
Take out eat, shopping, all that
Shopping,
stuff,
they go and buy his groceries, and they help him maintain his apartment. And so he is just a prime example of where, if he did not have these services, these DSP, then he would not be able to live independently like he does. And so for the past 6 months, we have not had staff. We've been out there trying to find somebody, recruit and stuff, and haven't found anybody. So the executive staff and the admin have stepped up and tried to give him as much support as they possibly can. But he is just an example of what the need is out there, because without this, he would be possibly placed into a residential placement. And Kenneth likes doing his own thing, right?
Yep.
All right. Well, we appreciate this opportunity, y'all. Thank you so much.
Thank you.
Okay. Next up is Sonia Johnson, and on deck is Joan Ware.
Good afternoon. I am Sonia Johnson. I'm the Executive Director of Woodwright Industries located in Cartersville, Georgia. Woodwright Industries may be one of the oldest day programs. We started as a parental group in 1970, transformed to a day hub facility. My biggest concern, and it has been the hottest topic here, is the DSP workforce. One of the toughest challenges facing the IDD providers is the turnover for the direct support professionals. This workforce is a critically important part of the quality of care for supports for people with disabilities. When direct support professionals leave an agency, the impact is profound for the individuals and the professionals. One of my veteran employees, she left last year, and during her exit interview, she noted that the rate of pay was not life sustainable. I've been there. I've worked at Northwest Regional. I've worked in human services all my life. I agree with the other providers that you're in it for not the money. You're in it for the passion. But with the increase of everything and the inflation of everything within the whole entire state of Georgia, United States, it is not life sustainable. This statement spoke volumes to me. Even further insight, and some people also said it, we're in competition with McDonald's, no harm intended. Taco Bell right now, I think their rate of pay is like $17, $18 an hour. That's where she went to. She was a good direct support professional. I hate to lose her, but I had to, because she could not make it in her life. We were having some challenges with staff retention, and we still are. Pre-COVID and now moving forward, COVID-19 disruptions have resulted in direct support separation, state developmental disability system challenges, program closures, dislocation of people receiving services, and challenges to the DSP workforce as stated before. Although I have a great team now, we've been actively recruiting for a community worker for the same position for the last 2 years. Thank you.
Next on deck is Pat and Madeline.
Hi, my name is Joan Ware, and I have a 52-year-old son who is nonverbal, non-ambulatory, and non-visual. He lives at home. has always lived at home. He does not qualify or fit in to go to one of the programs like Network or for Floyd Training Center. My son draws Social Security survivor's benefit off of his father, which makes him ineligible for Medicaid. He is not, I cannot get him on the comp waiver because of that. Right now, we are paying out of pocket for help to come into the home. There are more children or adults like him that are out there that aren't getting services because of this problem. It would be good to see that this could be covered, addressed. Thank you.
On deck is Julia McGuires.
Go ahead, Mama. Go ahead. Okay. Someone to help me. You're gonna tell him to. Mama, you know it. Okay, please. Suddenly, my daughter's too shy to speak for herself today. My name's Pat Patrone. This is my daughter, Madeline Patrone. She's 46 years old. With intellectual developmental disabilities as a result of birth trauma, brain trauma and lack of oxygen. We do have the comp waiver. Thankfully, we got that waiver in time for me to actually be able to have a full career in corporate, and I didn't have to get on welfare and sit at home to care for her when she aged out of school. So for that, I'm grateful. I'm very grateful. Madeline started in traditional provider group homes and day programs, and I'm talking many years ago. What our experience was that there was in the day programs where we were, which was suburban metro Atlanta, there was a lack of involvement and engagement of the providers, the employees for these day programs. I volunteered there some, and I would come in. Staff would be over here chatting with themselves, and all of the clients would be asleep at their tables doing nothing. And that has happened in many, many, many of the day programs that she's been involved in. So thankfully, you guys have this direct, participant directed. And so we got her, another thing was the group homes took my daughter to their psychiatrist, and they changed her medicine, and that was what she wanted to tell about. Is she said group homes. Go ahead, tell them. What Group homes, they doped me up and they told me go to my room and never come out again.
Yeah, so that's what happened. She was, and I had a big fight with the doctors in the group homes because they were over-medicating her, and they were giving her the wrong medication. Thanks to the participant directed, I got her out of the group home. I got her off of all the wrong medications. I got her back on what she needed. We have a direct support person. Madeline has made her own day center. She gets out, she has her chores in the morning, she gets out in the community, and she does volunteer jobs, and she has a full day that is exactly what she wants to do, and she gets one-on-one support. So I want to thank you guys for that. On deck is Bradley Carlisle. Yeah. Julia is next. Julia McGuires? Yes. McGinnis. Okay. Yes. Working there, and she wants. Excellent. Bradley?
And then Mary, you're going to see last.
Okay.
I just want to say something real quick. So we're with the Down Syndrome Association of Atlanta. The reason we're here is because when we saw y'all recently, he decided that he wanted to testify for the first time, and he wanted his voice to be heard.
Hello, my name is Bladder Carlisle, and I have a Medicaid waiver. Is it important? To my, not to me, to me. Sure. My staff needs to pay. Pay. And every resident, and they do.
He wants to make sure they get paid a living wage.
Yes.
Hi, thank you for coming. My name is Mary Kimbrough. You want to stand there? Sorry, I have to reverse interpret here. There. Okay, so my name is Mary Kimbrough. I have a daughter who's going to be 39 on Sunday. She is deaf autistic. My daughter got cochlear implant at the age of 8 years old. She was one of the first children in the country to get it. And guess what? She's now got one of the oldest cochlear implants in the country. And we were recently told that Medicaid does not cover any cochlear implant expense, and hers will fail soon. Okay, you talked about one-time expense. That's mine. Okay, so that, and of course the same that everyone else here, is she lives independently. My daughter's neither fish nor fowl. She doesn't quite fit any category. She lives independently almost. She gets along fine until a crisis comes. But what do we have for them? Group homes don't fit, day programs. She works at Kroger. She'll bag your groceries. She wants to work. So I appreciate your hearing us today.
And Mary, thank you so much for being here today and being our interpreter. Let's give her a round of applause, please. Thank you to everyone who spoke. I'm going to have some final comments. I'm going to turn it over to our co-chair here, Senator Harrell. First thing is, if you can see the projector behind you, you will see that's our website. And that website is senateresolution770.com or 770.com. On that are several important things. If you wanted to see the video archives of both this or other meetings, they are online there. There's also information and news about what's happening with this committee, as well as upcoming meetings. And our next meeting is going to be held in South Georgia, down in Tifton, on August the 19th at 10 a.m., and we'll have that location posted soon. So you'll be able to see, October 19th, my bad. We're excited about that meeting, and you know, I know some folks here today either are not comfortable talking on a microphone, or you did come up and testify and you wanted to either provide more information or you thought of something afterwards. Well, that's one of the great things we have here. If you'll see where it's on the site right now, you can submit your testimony that way. And we would love to hear it. Please know that we are not just listening, but we are reading and taking all of that information in. And then from that, in our final meeting, we will be adopting a report with specific recommendations that will translate into either active piece of new legislation or in the legislation we do for our budget each year. So thank you all again for coming, and I have a special message for both those who are here with special needs. We love you. You're awesome. Keep smiling. Keep advocating. We're hearing you. And to the parents, grandparents, brothers, sisters, aunts, uncles, friends, and caregivers that are here, you're true heroes. Nothing short of it. Thank you for what you're doing, and God bless you.
I echo those words of Senator Albers. I could not have said it better. Thank you, everyone, for coming out and speaking today. You did an exceptional job of being efficient and keeping with the time limits. And I just have two things to say about that. One is that we need you because you are the ones who know what's going on. And we need that information to be able to do a good job ourselves. Two is because you were so good at keeping with the time limits and being efficient, it actually made it easier for us to be able to take in all that information and really process it. It really did help a lot, so thank you. But if you feel like you didn't get to say something you really wanted to say, please use the website and give us the rest of it. We will read every word of what's submitted through that website. And again, thank you. It's been a pleasure to be in Rome. It's been a long time since I've been here. It's a beautiful place, so thank you.